Dr. Martha Whyte, Regional Director, State Department of Health. Hey, Dr. Martha, welcome back to Keel. How you doing this morning?
I'm good. How are y'all?
Okay, so there's tons of stuff, all these supposed memos, the latest from Johns Hopkins, floating around on the internet, specifically Facebook, and it's all these rules about all these new rules to prevent. Are you aware what I'm talking about? Have you seen those on social media?
I haven't seen the one from Hopkins, but what are they telling people to do? Something different?
There is one of the rules listed, and I read this in another article this weekend also, that says now they, I guess meaning medical experts, think that the incubation period may be as short as 5 days, only 5 days of symptom free instead of the 14, that it could be now between 5 and 14. Have you seen that? Is that legit?
Well, it could be. You know, we're learning more about this virus every day. That's why our rules are changing every day. You know, you put out guidance and it changes, in a couple of days. However, if the incubation is shorter, that means as long as you're staying that 14 days, we've got you protected. At one point they were questioning whether it was longer. That didn't prove to be true, so we kept with the 14 days. But 5 days, 14 days, stay in for 14 days, we got you covered.
Doc, the governor they've stood up the convention center as a standby hospital site. Yes. Mm-hmm. Do we have that coming here? How soon and where?
Right now in our area, we're doing okay with hospital beds, with the number of vents that we have. We're not in that situation yet, but as you see how quickly our numbers are climbing, if we don't get this under control, yes, that's a place that we probably will go. The hospitals and our, what we call tier 2 hospitals, like our long-term care facilities, rehab hospitals, they've all been meeting and talking about options and what we can do. They've met with the mayor about options for a place like that. So plans are being made. We really, really don't want to have to go there. That's something that is not the best of care, but it's the best care that they can do when they're overwhelmed with patients.
Are we doing better on getting the test results back quicker?
We are getting tests back quicker, and I think we're going to see that continue to improve. There's several more places that are offering to run tests. We've got LSU, we've got other labs that have come online, other hospitals are looking to pull in their own ability to test. So I think we're doing well with that. My concern really is two things, really people paying attention and knowing that this is something that we can break this chain if we just do the right thing. And the other thing is, one of the things that I've been noticing in our case studies is that we have families that are getting it. So you know how you said you were home and your son was staying in his room? Mm-hmm. I know it's hard sometimes when you have a big family in a smaller home, but the more you can keep your 6 feet, the more you can clean your surfaces. Think about your light switches, your doorknobs. I mean, like every couple of hours, just go along and wipe them down. Wash your hands a lot and try to keep your distance from each other, especially if you think someone is sick. Keep them in their room. Bring stuff to the door. Let them take it from outside the door, and walk away and let them open the door and grab it. Those are the things that we need people to think about, because we are, like, I have a family that has 6 people. All of them are sick.
So what you're saying is, and people, because this is kind of a two-part question, but I'm going to skip the first part, go right to the second. What you're saying is that
Okay.
we'll come back to the first one eventually. That's how I roll. So what you're saying is that people need to social distance even within their own homes and families.
Yes. Please realize that none of us know who is carrying this virus and incubating it right now. So the more we realize that I could have it and you could have it, so I don't want to give it to you and I don't want to get it from you. So if we keep that distance from everybody, we can break this chain.
Which brings us to the first part of my two-part question after we cover the second. And this isn't really a medical question. You have to have noticed this. I would say probably at least half the people that I see are thinking of this stay-at-home thing as nothing more than a green light to have a block party. I'm right, aren't I?
Yes. We have a lot of house parties, apartment parties, block parties, picnics, cookouts. This is not the time for that. It's just not the time for it. People are dying. And while most of us aren't getting that sick, we have over 150 deaths in our state. We have people dying in our community, young people, 34, 44, the 17-year-old boy in New Orleans. While you may or may not get to that point, we just don't know. It really depends on your health and how you're going to handle it. I have someone very close to me, healthy, doesn't take a single medication, 50 years old, and is on a ventilator. And, just in a short period of time went from okay to I can't breathe. So we don't know who those people are going to be. We assume it's the elderly. We assume it's people with underlying disease, and that's the most likely person it's going to be. But there are others that are getting that sick.
One more thing. Getting outdoors, walking the dog, jogging, sitting by the pool even. Are you okay with all that?
That's okay. Yes, as long as you're still social distancing.
Okay. What if it's a community pool? What if it's at your apartment and just don't have more than 10 people out there?
It depends on how big the pool is, right? If you can keep your distance from someone, really keep your distance. It's okay to be outside. It's okay to exercise. That's good for us. Keeps us healthy. Sunshine is good for us. But truly, we have to focus on the surfaces that we're touching. If we're touching a lot of surfaces that other people are touching, really keep your hands from your face. And keep that distance from someone that, even your family, so that you can keep those germs away from your face and out of your body.
Lastly, the numbers today, what are you looking for to see that we've made progress?
We want to see our numbers slow first. We want to see the numbers of new cases slow down, and we want to see them, that curve just keep bending down. If I had 20 yesterday and I have 10 today, and I keep 10 tomorrow and then keep going down, I'll be doing good.
Yeah. Dr. Martha Whyte, thanks for your time. I know you're a busy, busy woman, and appreciate you joining us this morning.
Well, thank you for talking about this so much. I appreciate it.